you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself.
In with this week's edition of Health Matters, I am your host, Nevis, Senior Health Educator at the Health Promotion Unit. The Health Promotion Unit usually recognizes HIV twice a year. We usually have Regional Testing Day in June, and on December the 1st, which is World AIDS Day, we usually have our HIV Testing Screening Day as well. This year, we decided to recognize Regional Testing Day by doing something a little different because of the atmosphere that COVID-19 has created. So with me this afternoon, I have 3 persons with me, and they're going to introduce themselves.
Hello, my name is Nadine Carty-Keynes. I'm the coordinator of the Health Promotion Unit HIV/AIDS program here on Nevis in the Ministry of Health and Gender Affairs.
Hi, good afternoon. My name is Dr. So Willett. I'm the project coordinator with the Capacity Building Project for Chronic Metabolic Diseases, and I also partner with ICDF.
I'm Teresa Herbert, the HIV Education and Prevention Officer at the Health Promotion Unit in Nevis.
Okay, welcome everyone.
Thank you.
So tell us a little about Regional Testing Day and how this interview came about.
Regional Testing Day is an activity that the HIV/AIDS program has been hosting for several years. We took a break, but we intended to restart that again this year. And the Regional Testing Day came about in 2008 as an initiative with PANCAP, the Caribbean Media Alliance, and National AIDS Program in the Ministries of Health across the region. COVID-19 kind of put a damper to that event, and we had strong intention of executing such an activity here again. However, I'll let my colleague Teresa speak about what those activities were, and Dr. Willett would also mention some of the partnership that they were intending to have with us for Regional Testing Day 2021.
So, thank you. Prior to the Federation experiencing the National AIDS Program, including the Health Unit, in partnership with the International Cooperation Development Fund, ICDF, which is who Dr. Willett is affiliated with, planned on hosting a major regional testing day, which would have included HIV testing as well as testing for NCDs, including diabetes, hypertension, etc. However, with the current restrictions on mass gatherings, we had to rethink our approach. But instead of canceling altogether, we do plan to host the event eventually once we've gotten the COVID situation under control. But in the meantime, we decided it would be useful to the general population, particularly those living with HIV and NCDs, for us to use this forum to address the management of HIV and NCDs during this COVID pandemic. And this is in the hopes that ensuring our clients have access to information and health services and are well informed and able to make the best decision for themselves.
Thank you, Teresa.
Well, I think Teresa answered for me. So I echo her sentiments.
Okay. All right. So what role is the ministry playing in addressing COVID-19 among people with HIV?
Well, our HIV services continue. Given the situation here in the Federation, we are able to still execute our rapid testing services, and those are being done at the Gingerland Health Center, Combermere Health Center, and Charleston Health Center at this time. And of course, our ARV, which is our antiretroviral treatment, is also accessible and available to persons who are HIV positive and they need their medication. So those types of services are still ongoing. Services at the lab, routine tests at the lab, Alexandra Hospital lab, it has been suspended. However, in terms of person needing to know their HIV status, we encourage persons to visit any of the 3 health centers that I would have just mentioned. And I think in terms of management, persons who need any counseling, you can definitely reach out to the Health Promotion Unit, or you can visit any of the health centers on the island in terms of counseling. for HIV and AIDS in terms of whether you want to know if you're making the right decisions, how to practice safer sex, and how to stay informed. And of course, you can also tap into your physicians if you're HIV positive and you need to ensure that you're staying on the right course of treatment and just to stay abreast with what's happening around you and your management of HIV.
Are people living with HIV and non-communicable diseases at a higher risk for COVID-19 than other persons or persons who are not?
While we are still learning about COVID-19, how it affects people with HIV, based on data, I believe people who are on effective treatment have the same risk for COVID-19 as people who do not have HIV. Having said that, while persons with HIV may not be at an increased risk for contracting COVID, like other persons who have underlying medical conditions, they may be at a greater risk for experiencing severe COVID outcomes. This particularly pertains to clients with a low CD4 count and clients with poor treatment adherence. So we just want to take extra precautions and avoid persons living with HIV contracting COVID altogether.
Okay, thank you.
As Teresa said, persons with underlying diseases, including those with non-communicable diseases such as cancers, diabetes, and chronic heart disease, they do have an increased risk of severe COVID-19 complications, including death. We've found that persons living with such conditions are more vulnerable and should take extra precautions during this time.
Are persons living with HIV and NCDs advised to take the vaccine?
Well, the Ministry of Health encourages persons with HIV to take the COVID-19 vaccine. To date, the vaccine haven't shown any interference in terms of any treatment that persons who are HIV positive are taking. So yes, we strongly recommend that persons who are HIV positive take the vaccine. If you're uncertain, you can definitely have a conversation with your physician and then get some clearance there. But at this point, we do recommend taking the vaccine.
Okay. The latest data that was received from the WHO pertaining to the AstraZeneca vaccine has shown a similar efficacy for persons living with NCDs. And it is indicated for persons living with NCDs, including cardiovascular diseases and cancer. I will say that there's insufficient evidence when it comes to severely immunocompromised persons in the case of efficacy and safety, or persons that are actually on immunosuppressants, so they may have a reduced immune response. So if you are severely immunocompromised or on immunosuppressants, then I would suggest that you speak to your doctor first.
Alright.
It is recommended.
Should we expect shortages in HIV medicine in St. Kitts and Nevis?
So while some countries are experiencing a shortage of their supply of HIV medicine, fortunately we are currently not experiencing any issues. Persons living with HIV in Federation usually receive a 3-month supply of their medication. So for the most part, our clients should be well stocked. However, given the uncertainty of current restrictions and lockdown measures, and we're not sure when the community spread will end, we would advise clients to, if they're running low or nearing the end of their 3-month supply, to definitely reach out to their physician and restock to avoid interruptions in their treatment.
Okay. Will there be any interruptions or shortages expected in services needed for persons living with NCDs?
Well, we've been very fortunate, as Terry said. There has not been any interruptions in services. As a matter of fact, the health centers are still having their monthly diabetic and hypertensive clinics. Well, I will say the Charlestown Health Center did say they will cancel this month's clinic only because of scheduling conflict, but it will resume from next month. So persons living with NCDs can still call the health centers and visit at the appropriate time. We will not advise persons to bombard the hospitals or the clinics, however, to avoid contact with any infected persons, for their own safety. But they can call in, you can call your physician, you can call the health centers, and as a matter of fact, the nurses are very good at contacting the persons living with NCDs in their charge, so they do regular checkups. So as of the day today, we have no interruptions. We don't know what the future may hold, if we have any community spread, but as of now, no, we have no interruptions.
It's amazing. Are any arrangements being made for home delivery of medications for HIV positive persons and other high-risk persons living with NCDs or pre-existing conditions?
Well, no disruption there either. Fortunately, like Terry mentioned, for persons with HIV, we normally have a 3-month stock of medication, and arrangements can be made similar to what is currently being done in terms of reaching out to their physician to get their prescription for their 3-month supply. And if they seem like it's going to go low, they can also make contact for pickup, whether a trusted family or friend or themselves can pick it up, or they can make arrangements with their physician to collect on their behalf, and then they can collect from the physician. So we'll make whatever adjustments we need to make to ensure that persons are getting their medication. So once you reach out and we're aware, or your physician is aware specifically that you need these meds, we will make whatever adjustments, even if there is a restriction of movement of some sort, whether now or in the future. I hope not, but hopefully there will be no more additional disruptions, but we will make the adjustments, definitely.
And it's the same situation with persons living with diabetes or hypertension. You can get your 3-month supply if you can call your primary care doctor, you can call the health centers and arrange pickup. They try to work with you as best they can as of now, and even if, as Nadine said, there is restriction in movements, they will still work with you and try to get your medication as quick as possible.
Okay. Has HIV testing and other services in Nevis been slowed or been impacted by the COVID-19 pandemic?
Well, globally, HIV testing has fell around 41%, as reported by the Global Fund. Nevis has also experienced a decrease in HIV testing, but more so due to the fact that the focus is on COVID-19 at the moment, not due to the fact that there's been any restrictions on access to HIV testing. As Nadine mentioned before, we are still offering rapid testing at 3 of our health centers, Gingerland, Charlestown, and Cumberland. So our concern is that with an increase in testing, we don't want to see an increase in HIV infections later on. So we are still asking persons to ensure that they get their HIV tests done as often as they need to. The only service that may be impacted is at the Alexandra Hospital. They have currently suspended routine tests due to the COVID-19 pandemic. So they will not be doing HIV tests at the moment. So we are asking the public to go to the clinics and get their tests done there. In terms of other services, our school sex education program has been severely impacted. During last year, the restrictions of in-person classes, particularly at the high schools, has prevented us from going in and doing our usual classes to promote comprehensive sexual health education. So the concern there is that with our youth and adolescents not receiving the education, the sexual health education that we would like, that we may see an increase in risky or unhealthy behavior. But we will find some way to counteract that. So yeah, those are the restrictions or changes to our services.
So I just wanted to reiterate for the listening audience and the viewing audience that the testing that we're speaking of would be the rapid testing that you would get at the health centers.
HIV.
The HIV rapid testing at the health centers. If a person who is HIV positive begins experiencing COVID-19 symptoms, what are the protocols for seeking care?
Well, these same protocols apply just like any person. If you are experiencing symptoms, we want you to self-isolate. We want you to isolate yourself first. And then you want to call the respiratory checkpoint at 665-5473, and they will provide you with any instruction needed. If you're to be sampled or a COVID test is to be done, you still self-isolate until you get your results. If the result is negative, then of course you can move around. If it's positive, you get further instruction as to how you can continue to self-isolate. The measures are pretty much the same as with anybody. You do not have to disclose your HIV status if you call the respiratory checkpoint. However, if you do think you have been exposed or you're experiencing symptoms that are suggestive of COVID-19, then I would also encourage you to call your physician and inform them that you may have been exposed or you think you're having symptoms, in addition to calling the respiratory checkpoint at 665-5473.
Can someone have sex during the COVID-19 pandemic?
The short answer is yes. COVID-19 is not a sexually transmitted infection. However, it can be spread through close contact while having sex or being intimate with someone. So we're advising that people avoid or limit sexual contact with persons that they don't live with. Having safe sex with a partner you live with is okay, as long as neither of you have symptoms of COVID-19. If you or your partner are experiencing COVID-19 symptoms, as Nadine said, you should keep your distance, you should self-isolate, and take precautions and testing before restarting your sexual activity. For persons that have sex with multiple sex partners, we're asking that you consider reducing the number of sex partners that you currently have, just to decrease your exposure to COVID-19, as well as to protect those around you that you care about. In general, overall, we strongly encourage that you use condoms when engaging in any sexual activity.
Are there any interruptions in services at the health centers?
At this time, there aren't any interruptions for giving HIV testing at our health centers. Rapid testing currently being offered at the 3 health centers we've been mentioning, Charlestown, Jijilan, and Humbermere. The health centers are currently also offering the COVID-19 vaccine, so it may be helpful to call ahead to the center of your choice just to see what the wait time is like. In general, the lines are not long, and the rapid test only takes 20 minutes to reveal the results. However, if the COVID situation will worsen, we may have to make changes accordingly.
All right. What are the non-pharmaceutical measures persons with NCDs can do at home?
Okay, as we have mentioned before, we know persons with NCDs have a higher risk of severe outcomes. Therefore, we ask everyone to be extremely vigilant during this time. We ask persons to have a balanced diet. Increase your green and leafy vegetable intake. We ask you guys to drink as much water as possible, rest as much as you can, and you can adopt an exercise regimen at home. If you live with younger persons, YouTube is always there. I mean, I know many persons can just pull up a YouTube video and follow along, or for persons who may be living alone, you could just walk around your house, get some sun, and try to keep your mental awareness up. Try to be, because I know during this time when you're alone, you might get a little bit more depressed. So, some sunlight might be good. You can try to call your friends and families as much as possible. We ask everyone to remember those who are living alone at this time. You can just call and check in and check up on your loved ones. Make sure that they're eating well, make sure that they have no symptoms. So we're just asking everybody to be as kind to each other as possible.
Some good words of advice. And is there any additional information that any of you would like to add for the general public?
Well, I just want to remind persons of the non-pharmaceutical measures for COVID-19, wearing of your face mask when you're in public spaces or when you're among other persons, to keep physical distance among yourself. Physical distance from other persons, 6 feet or more, and to wash your hands or sanitize your hands if soap and water is not available, and to clean surfaces often. And of course, we have the COVID-19 vaccine that persons can take if they choose to. So these are some of the other measures that can help persons who are HIV positive or persons who are living with NCDs or just the general public to protect yourself from COVID-19, and just stay aware of information. Please tap into reliable sources. Facebook and other social media platforms don't necessarily always have on reliable sources unless you're tapping into WHO, Pan American Health Organization, PAHO, UN-AIDS. UN-AIDS is the arm that speaks to HIV and AIDS. And PANCAP is also another source for persons who are living with HIV and AIDS. So those are some of the reliable sources we want you to tap into. And of course, you have the Ministry of Health, you have the National AIDS Program, you have the NCD program that is here in country that can help you with information. And of course, as Dr. Willett said, please have a healthy diet as much as you can. Put those dark green leafy vegetables, or any vegetables at this point. Add some fruit. Try to keep that balance. Stay away from fried food and highly processed foods. Junk food, I know sometimes you want to snack a lot, but snack once in a while. Nothing is wrong with that, but just don't overdo it. Practice safe sex. Health promotion unit, we have condoms, we have lubricants. If you need, pass by, of course wearing your mask, and then we can supply you with what you need. And just remember your mental health. Talk to friends and family. Stay aware, stay informed, reach out.
Anything else you want to add? Good. Terry, you want to add anything?
No, thank you.
That's around.
All right. So that has been this week's edition of Health Matters. We hope that you listened, you understood what we were saying, and that it's knowledge that you can take forward and spread the word. Everyone tell someone. If you took nothing else from this interview, we ask that you remember that we're still offering HIV rapid testing at 3 of the health centers, the Combermere Health Center, the Gingerland Health Center, and the Charlestown Health Center. We're still offering COVID-19 vaccines at all of the health centers on Nevis, all 6 of the health centers on Nevis. We prefer if you call first before going in, but if you walk in, you'll still be welcomed. Persons living with NCDs, persons living with HIV, you can still get your services, your medication, and you can also still get your services at any of the health centers and the hospital if that's your last. We would prefer that be your last resort, the hospital, because the health centers are available 8 a.m. to 4 p.m. every day. And like Nadine said, the health promotion unit is available for condoms and other stuff like that. Thank you for viewing, and we ask that you continue to be safe and protect yourselves and others.
Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself.